Hey guys, my name is Dr. Bhasin from strengthnu, your fitness and therapy experts. Today we're going to talk about something I've been seeing a lot more in practice called winging of the scapula. Now before I begin, I want to ask you guys a question. So when you're working out at the gym, doing an upper body workout, do you ever notice that one side maybe fatigues more than the other side, or maybe it has a little bit more pain than the other side, clicks more than the other side, or is even weaker than the other side? Or maybe you've been doing some push-ups on the floor and one of your buddies tells you, hey, when you're doing the push-ups, I can see your scapula, which is that shoulder bone at the back there, sticking up more on one side or on both sides. If so, you could be suffering from winging of the scapula. So what the hell is this thing? So winging of the scapula is a condition by which a muscle called your serratus anterior, or the nerve that supplies the serratus anterior, becomes weak or injured. Check out this picture of Rocky IV for a good look at the serratus anterior. The purpose of the serratus anterior is to bring the scapula and hold it down to the thoracic wall like a suction. When it's not doing its job properly, there's a lot of problems that can occur at the shoulder. So there are many ways one person could injure their serratus muscle or their long thoracic nerve, the nerve that supplies the muscle. However, some common ways can be lifestyle, such as holding a baby or a heavy backpack or a purse for extended periods of time, even playing certain sports like contact sports where you'd have blunt trauma to the muscle itself, or even throwing sports like baseball or sports where you're bringing your arm through like volleyball. That can also injure the muscle itself. And I know what you might be thinking. Okay, I play some of these sports, I have an injury to my shoulder, I hear some clicking, I hear some popping. What the hell can I do about this? Well, I'm going to take you through some exercises right now because a good place to start is with rehab and strengthening of the muscle. So the first exercise we're going to do is scapular protraction and retraction in a high plank position. So what you do is you find a piece of floor, some ground, you're going to come into the high plank position, keep your back relatively straight, and then you're going to retract your shoulder blades, keeping your arms straight. Come to a nice comfortable position, and then protract and come the other way. Notice how I'm not bending my elbows at all, and most of the movement's coming from the shoulder blade and the serratus anterior muscle. So the second exercise we're going to do here, again, is a scapular protraction retraction exercise. We're just going to do it one arm at a time. So make sure you set the weight at a comfortable level, so you can do about 10 to 15 pounds without too much resistance and too much pain. You're going to bring your arm out to the front here, keeping the arm straight, and again, just retracting and protracting. And again, 10 to 15 repetitions, 3 to 4 sets. So the third exercise we're going to do here is a shoulder flexion exercise. However, when doing this one, make sure you're depressing your scapula. What I mean by that is you're forcing it down as your hand is coming up. So what it's going to look like is something like this. Notice how my shoulder is not at the end hiking up like this. I'm trying to keep it depressed like that as I come up and down. If you guys are experiencing pain at any point during these exercises, make sure you consult your doctor, chiropractor, or physiotherapist, as it might be a little early for you to start with the rehab. And remember, you're just one strategy away from crushing your fitness goals.